So hi friends. So today I thought we'll discuss few questions from ENT. So before starting with these questions, you should know that in ENT we should always ask the common presenting symptoms like deafness, vertigo, tinnitus, and also pain. Pain is important, and also the main commonest feature is discharge. Okay, so we should ask a proper history. So let's get started. We can actually look this question. So this question is a 30-year-old female patient presented with right ear deafness. Okay. So with decreased corneal reflex, and it is associated with tinnitus. Tinnitus means ringing sensation and vertigo. Okay. Again, acoustic analysis showed sensory neural hearing loss. So what is the likely diagnosis? So they have given three options. So the first option is acoustic neuroma, Meniere's disease, and otosclerosis. Okay. So this is the question. So the main points we should note is, one is he is presenting with deafness. Okay. Again, decreased corneal reflex. So we don't know why this happened. And also this is associated with tinnitus and vertigo. Okay. Tinnitus and vertigo. So remember, always, as I said, in ENT questions, we should ask proper history regarding these three, that is deafness, vertigo and tinnitus, because these three features are associated with many other conditions also. Okay. So in this questions, they have given these three things, that is deafness, vertigo and tinnitus. Also, they have told that the deafness is of sensory neural hearing loss. That means this is actually affecting his nerves. Okay. So let's go on to the options. So the first option is acoustic neuroma. Okay. So remember, I'll tell you something regarding acoustic neuroma, since it is an important, like even in exam point of view, this topic is really important. Okay. So acoustic neuroma means basically it is a tumor. Okay. So it is a tumor which is located in CP ankle, cerebellopontine ankle. Okay. And also this condition is also known as vestibular schwannoma. Okay. So these are the basic things. Again, what are the main presentation? Okay. So as I said, here also there will be deafness, vertigo and tinnitus. Okay. And in acoustic neuroma, the most important is it will be sensory neural hearing loss. Okay. Plus there will be some cranial nerve involvement also. Okay. So it can be trigeminal nerve, that is fifth cranial nerve. So the patient sometimes will be having features like reduced facial sensation, then reduced corneal reflex, all those symptoms. And the other one is seventh cranial nerve. So they can also present with facial palsy. Okay. And also the last one is the eighth. Okay. That is vestibulocochlear nerve. That's why we have this DVT symptoms, or deafness, vertigo and tinnitus. Okay. So here the answer is acoustic neuroma. Okay. Again, let's discuss this Meniere's disease and otosclerosis. So I have few slides. So in this slides, I will be discussing more about these two options. Okay. So that's about acoustic neuroma. Again, let's move on to the second slide. So this is the second question. Okay. So the question is, a 33-year-old female, so this is a female patient, complains of sudden headache. Okay. So acute onset of headache. In her family history, her mother became deaf at 30 years old. Okay, that is early onset of deafness. What is the most likely diagnosis? So the options are same, acoustic neuroma, Meniere's and otosclerosis. Okay, so they haven't given any other options, like they didn't, like in previous slide they gave us more information like vertigo, tinnitus. So we had a better idea. But in this slide, it's just headache, sudden onset of headache, and most important thing is family history. Okay. So before coming to each condition, you should know that. So here the answer is otosclerosis. Okay. So we'll be discussing more about this otosclerosis. Okay. So first of all, otosclerosis means it is a familial condition. Okay. That means like it usually runs in family, like as a autosomal dominant condition. Okay. So what happens in this condition is, we know that in middle ear we have three bones, malleus, incus, stapes. So what happens is the working or the normal functioning of these bones are being affected. Okay. So this results in conductive hearing loss. Okay. So we know that whenever there is any problem in the conduction, okay, noise conduction, So what happens? It can result in conductive hearing loss. Okay. So when we check these options, here I already said the acoustic neuroma, it causes sensory neural hearing loss. Okay. And also the second option is Meniere's disease. Okay. And for your information, Meniere's disease also causes sensory neural hearing loss. Okay. So by easily we can actually differentiate. Okay, so if they are directly giving you that it is sensory neural hearing loss, we can actually rule out this otosclerosis because this is an example for conductive hearing loss. Okay, and also the most important thing is family history. Okay, this otosclerosis runs in family. Okay, again here in this question they haven't given any features, but the most common features here also it is DVT. Okay, that is deafness, but the deafness is conductive hearing loss, then vertigo and tinnitus. Okay, so easily you can find out. Okay, again we can discuss the third question. So the third question is, a male patient presented with vertigo, sensory neural hearing loss. So they have given sensory neural hearing loss and tinnitus for the last 3 years. Okay, so it's long term features, that is DVT. The patient is having deafness, vertigo and tinnitus. Okay, but now something has happened to this patient. So now he has presented with parasthesia and numbness in the left side of face. Okay, by investigation CT scan showed a mass in cerebellopontine angle, CP angle. So what is the likely diagnosis? So the options are same. So we know that here what happened is the patient is having DVT plus some more features. Okay, so the extra feature is parasthesia and numbness in left side of face. Okay, so this is cranial nerve involvement. Okay, so easily we can find. So the answer can be acoustic neuroma. Okay, so this is how we can identify and easily identify each answers. Okay, it's actually easy. So just remember, if it is DVT with any family history, okay, so in that case it can be otosclerosis, but not always. You should actually check anything else more. Sometimes they will be giving you some more clues. Okay, so if it is just DVT plus family history, we can actually opt this otosclerosis. Okay, again if it is acoustic neuroma, usually it is of sensory neural hearing loss along with vertigo and tinnitus, and there will be some cranial nerve involvement also. Like it can be facial palsy or some numbness, like absence of corneal reflex or numbness or parasthesia over face. All these symptoms can occur. Okay. Again coming to Meniere's disease, here also it is DVT. Okay, I already said that means deafness, vertigo and tinnitus, and here it is sensory neural hearing loss. Okay, but patient also complains of one more symptom. Okay, so they will be complaining fullness in ear. Okay, so that is also an important feature, fullness. Okay, so easily we can identify each condition. Okay, so thank you.